My name is Dr. Rachel Njogu. I'm a physician at Nairobi Women's Hospital, and I run medical outpatient clinic at this facility. And so today I'm going to talk about asthma, and asthma is basically a chronic inflammatory disease that affects the lungs. And so what happens is that patients will have inflammation of the small airways, and they present with difficulty in breathing. So asthma can affect any age, from pediatrics to elderly patients, and we have what we call adult asthma. And so patients present with different symptoms. There are those who present with cough in the morning or at night or without any diurnal variations. There are those who present with difficulty in breathing, chest tightness, chest pain, or even wheezing. And so when patients come to us, we usually like to know whether they have any risk factors of what causes asthma. We usually have genetic factors and environmental factors. So basically, genetic factors is they have had a family history of asthma, or their environmental factors from occupation, could be insecticide exposure, it could be pollen, could be dust, could be cold, could be infection, could be exercise, or could be stress. And so when a patient comes to us, we have to approach this condition holistically, and we individualize treatment. So when a patient comes to Nairobi Women's Hospital Medical Outpatient Clinic and probably they are suspecting they could be having asthma, we usually have an education plan where we educate them about the disease, and then we have an asthma plan for that patient. And of course, we have to ensure that there is adherence to treatment, they're having the right technique of inhaler use. If a patient is too old or is too young or has some muscular conditions that make them not be able to use the inhaler correctly, then we can even advise them to use something like a spacer. We also want them to have a plan where they write to us how their symptoms have been controlled at home. So when it comes to management, the Global Initiative for Asthma usually recommend that every patient who has asthma has to be on an inhaled corticosteroid inhaler. So basically, whether you have controlled asthma or poorly controlled asthma, it all depends with the dosaging of your inhaled corticosteroid inhalers. Of to notice that there is another drug we call reliever drug, where most patients usually use, and they forget that this drug is just to relieve the symptoms. But the Global Initiative really insists that every patient, whether they have mild disease or severe disease, is that they have to be on a low dose or a high dose depending on their presentation, in order to be able to prevent frequent exacerbation or getting frequent asthmatic attack.